Hi, this is Dr. Arun Kannan, orthopedic surgeon from Apollo Hospital, Chennai. In this video, I will talk to you about what is a dual mobility hip replacement. I practice at Apollo Hospital, Chennai and specialize in hip and knee surgery. So we get a lot of patients for hip replacement and a lot of them seem to be knowing about something called a dual mobility hip and they are interested in knowing about what it is and what advantage it gives them. That is why I thought of putting up this video here on YouTube. So a standard hip replacement goes like this. Obviously, all of you know that the hip joint is a ball and socket joint. We replace that with a similar shape. So there is a pin, the large metal that holds the ceramic head usually on top of it. And then the ceramic head is in turn placed inside a polyethylene liner. This polyethylene liner is attached to the metal socket that goes into the cup of the hip joint. So the polyethylene or the plastic liner is fixed to the metal shell and the ceramic ball moves within this plastic. That is how a standard hip replacement looks and that is what I have shown here. When you come to a dual mobility hip replacement, this generally has one additional metal liner. You have the same normal socket, but this can take an additional metal liner that is shown in the bottom right corner. So this metal liner is again smooth on the inside and this houses or takes the polyethylene. The different thing about this is that the polyethylene can in turn move within the metal socket here. There is also the ceramic ball that goes inside the polyethylene liner. So there are two levels where the hip moves here. One between the metal socket or metal liner and the polyethylene, and then the ceramic ball moves again within the polyethylene. So that is why this is called a dual mobility hip joint replacement, because it moves at two places. Now, what is the advantage of using this as against a standard hip replacement? If you look at a standard hip replacement, the ball size is generally smaller as compared to a dual mobility hip replacement. The head size we call it. So this is smaller and therefore the dual mobility hip replacement having a large effective ball is more difficult to dislocate as compared to a standard hip replacement. It moves slightly more than a standard hip replacement, but that is not the main benefit or the main use or why we use a dual mobility hip replacement. It is to give more protection against hip joint dislocation after it has been put in. Therefore, we generally selectively use it in patients who are at a slightly higher risk of dislocation. People with hip fractures who are undergoing hip replacement, young people who had their hip dislocated from their childhood, we call it dysplasia. These people benefit from a dual mobility hip replacement. And patients with neurological disorders, these people typically benefit from a dual mobility hip replacement rather than having a standard hip replacement. But because again it moves at two different places, there is the possibility that wear and tear can happen at two different joints. So we reserve these generally for people who are at a higher risk of dislocation. Just to show you a small example, this was a lady who had a hip replacement done elsewhere in Assam. Initially it was okay, then within few weeks a complication happened. Initial x-rays you can see that the ball is within the socket as shown in this blue circles. Then what happened within few weeks was the ball came out of the socket. This is what we call as a hip dislocation. So once this dislocation happened, they reduced it, again it dislocated, so it was an unstable joint. That is when she came to us for further treatment. Here you can see that the ball is out of the socket. So we revised or changed this from the standard hip to a dual mobility hip replacement. So she got this dual mobility hip replacement and now it has been a few years since she had it. She continues to remain stable. Thus in a nutshell, a dual mobility hip replacement has two junctions, one between the metal liner and one between the ceramic and the polyethylene. Therefore, it moves at two different places. The main advantage of this is it has an effective large ball and therefore it has a lesser chance of dislocation. It is particularly useful in people who are at a higher risk of dislocation. Thank you very much.